So somebody's going to have to explain to me how this makes sense. This person says, start with getting rid of the ACA. Best way to start fixing healthcare. So your answer to fix the healthcare problem in the United States of America is not to deal with insurance companies that deny claims. It is not to deal with the outlandish cost of healthcare. It's not to deal with medical malpractice or deal with misdiagnoses. It's not dealing with the fact that we have a healthcare system that says, if you can't afford it, fuck you. Tough shit. Your answer is to create millions of people in this country who don't have health coverage. Remember, the ACA provided health insurance or health coverage to 22 million more Americans when Obama left office than before he came into office. 22 million more. And in fact, just a couple of years ago in 2023, roughly 40 million individuals benefited from ACA-related programs. So, your idea for fixing healthcare in America is to make sure more people don't have health coverage. How does that fix healthcare in America? It does nothing to address the for-profit healthcare system that we have. It does nothing to address insurance companies dropping you when you need them the most, denying claims when you need them the most, making you jump through hoops in order to get a claim coverage. It doesn't deal with the fact that we have to pay exorbitant amounts of money to even have health insurance and then pay, even more money to actually utilize said health insurance. It doesn't deal with any of that. It doesn't deal with the issues with Medicaid and Medicare. It just strips health coverage away from more people. So how does that help the healthcare system? How does getting rid of the ACA fix our health, or start fixing our healthcare in the United States of America? How does making sure that tens of millions of Americans don't have any coverage at all actually make healthcare better? I'm sorry, it's one of the dumbest things I've ever read in my entire life. That the way we fix our healthcare system is not by addressing any of the issues within healthcare. Not one of them. Ignore all of those and just make sure fewer people have health coverage. I wonder if you would feel the same way if your family had the ability to benefit from ACA-related programs. When my wife was moving from one job to another job years ago, well over, 10, 12 years ago, for a brief period of time, we had coverage through the marketplace, through ACA, because there was a gap in coverage. Her new company's insurance didn't kick in until a certain month, and we didn't have any coverage in between. We had two children at the time, and we needed to make sure that we were covered. So we got coverage through the ACA, coverage that we couldn't afford without the ACA. Our health insurance now that we're self-employed is through the marketplace. So just, if you could please, elaborate on your thought process on how making sure that tens of millions of Americans don't have any coverage at all is the way to start fixing healthcare.